While waiting times have decreased in the past year, the waiting period for patients is now approximately 5.5 hours. This makes the Free State the worst performing province in all provinces that have been monitored. Ritshidze reports that 41% of people blamed the long wait on staff shortages. The organization says one way to reduce waiting times is to reduce the burden on facilities by giving people living with HIV longer supplies of treatment. However, only 3% of people living with HIV interviewed received a 3 or 6 month refill. The organization says this is dismal in comparison to 64% in Mpumalanga, which is the best performing province monitored by Ritshidze.
Not only would multi-month dispensing mean fewer trips back to the clinic, making medicine collection easier for people living with HIV, but it would also reduce the burden on congested and overstretched facilities. In comparison to the Free State, 64% of people living with HIV interviewed by Ritshidze reported a 3 to 6 month refill in Mpumalanga. Outside of South Africa, other PEPFAR-supported countries report more than 80% of people getting a 3 to 6 month supply.
According to Positive Action Campaign in the Free State, many sections of the townships rely on one facility, which stalls service delivery.
What is important is to say to avoid the congestion within facilities and to deal with this issue of shortage of staff, because it's difficult for the department at the moment to hire staff. We suggest that they give people 3 to 6 months supply. That will reduce the burden of people or the number of people that goes to that flocks to facilities. That is what we're looking at. If we can give people 3 to 6 months supply, you've got at least half of people who are taking medication who won't be coming to the facility for the next 6 months.
The Department of Health in the province says it has noted the concerns that were raised during the release of the report. It says some are specific to regions and facilities.
The Free State Department of Health acknowledges the work that has been done by Ritshidze, which has been enabled by the Department of Health. This work looked at challenges in our health facilities that are experienced by people living with HIV and made a number of recommendations that have received the attention of the department, leading to specific remedial actions being developed and clarifications done in areas where the organizations of people living with HIV did not understand the actions of the department.
According to the report, a lack of friendly, safe and confidential services were the biggest reasons why people stopped going to clinics altogether. SABC News, Bloemfontein.